Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How long does it take Vyepti to work? Vyepti can work as quickly as the first day or week after your first intravenous infusion to help prevent your migraine headache pain. Vyepti, eptinezumab, is given as a 30-minute intravenous infusion at a clinic every 3 months, 4 times per year. It is not used to treat migraine headaches that have already started. Once the infusion is done, most people can go back to their normal daily activities. The recommended dose is 100 mg given every 3 months. Some patients may benefit from a dose of 300 mg. Related, treatment and prevention tips for living with migraine headaches. PROMISE 1 and PROMISE 2 were 2 Vyepti Phase 3 clinical studies where researchers looked at how well Vyepti worked and at its safety. PROMISE 1 was done in patients with episodic migraine and PROMISE 2 was done in chronic migraine. Vyepti had a treatment benefit over placebo, an inactive medicine, for both the 100 mg and 300 mg doses of Vyepti as early as the first day after the initial infusion. The percentage of patients experiencing a migraine was lower for Vyepti than with placebo for most of the first 7 days. The most common side effects, 2%, were nasopharyngitis, common cold, stuffy nose and scratchy throat, and hypersensitivity, allergic reactions. In studies, 1% to 2% of patients experienced an allergic reaction, compared to 0% in the placebo group. Some allergic reactions may be severe, for example, anaphylaxis, angioedema, and require treatment or discontinuation of treatment. Is Vyepti a CGRP antagonist? Yes. Vyepti is a humanized monoclonal antibody that binds to calcitonin gene-related peptide, CGRP, ligand and blocks its binding to the receptor. CGRP is a protein found in the sensory nerves of the head and neck area. CGRP can lead to inflammation and migraine headache pain by causing the blood vessels to dilate. Studies have suggested there may be a connection between CGRP receptors, and migraine. Vyepti was approved by the FDA in February 2020 and is manufactured by Lundbeck Incorporated. Learn more, new drugs for the treatment of migraine headache. This is not all the information you need to know about Vyepti, eptinezumab, for safe and effective use and does not take the place of your doctor's directions. Review the full Vyepti information and discuss this information and any questions you have with your doctor or other healthcare provider. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.